All right, what's going on, social workers? So welcome to week 4, and we're already more than halfway through the course. So you might be thinking to yourself like, dang, I don't know if I'm ready to practice. I don't know if I have the skills or whatever I need to do, with my clients. It's totally normal to have those thoughts. The most important part is, even if I'm having thoughts of doubt or self-confidence, or I have this imposter syndrome, the important part is like, am I willing to learn and grow through it and become comfortable with the discomfort? Because I promise you, therapy entails a lot of discomfort for both the client and the therapist. And so, speaking of practice and getting more comfortable, one thing I'd like to shed some light on is just the art of understanding nonverbal communication. And so what I would say is that your nonverbal communication speaks louder than verbal conversation. Huge difference between, hey, how's it going? And I say, hey, I'm doing really well. Versus, hey, how's it going? Hey, I'm doing very well. The words do not change a single bit, but the body language almost screams there's something out there. And so my practice, I like to let the clients that I work with know in my first session, we're doing informed consent, like, hey, there are gonna be times I'm gonna pause you. Just when I notice that we can do some work, something that's doing well, maybe some areas that we can focus on. And oftentimes if the clients are talking about something that's very painful, anxiety provoking, triggering, what have you, I'll often go with a saying like this, like, hey, I notice you kind of closing up a little bit. I notice your body language or your tone of voice really changing. Can we just pause and acknowledge this? Like, what's happening here? So I'm like, I don't know, I feel numb. Like, yeah, I can see that there's some pain here. Let's see if we can just explore that a little. Let's talk about that. I think this is important. Or they might get really anxious and talk very rapidly and what have you. It's like, hey, I'm noticing that your tone of voice, you're really getting pretty anxious, talking about a lot of things. Does that happen a lot in your life? Do you find like your mind goes into lots and lots of thoughts? How about we take a moment just to slow down and prioritize these thoughts and maybe write them down and choose what to focus on? That goes a long, long way. And so I encourage you just to do that with your peers throughout life, or even just recognizing your own body language. If you're feeling a type of way, what is your body telling you? Our body is always talking to our mind. We're always reacting with emotions. And in my opinion, emotions serve a very, very, very important function. So let's shift gears here a little bit. Let's talk about the upcoming assignment, the cultural competence one. So I'll be reaching out just to give you some feedback as the population that you selected, and make sure that you get your volunteer to fill out the informed consent, all that fun stuff. There'll be example vignettes that you can find in the Getting Started section of the course. So in there, you're gonna see things, depression, substance use, domestic violence, whatever it is. I encourage you to think about the entire context with this role play, because human behavior is a lot about connecting the dots. You can never really take people for face value. They're influenced by thousands and thousands and thousands of things. So I'd like for you to really think about the entire context. How does this depression show up? What does depression look like? Trauma, abuse, whatever it is. Pull up some articles, really educate yourself on that stuff, and use that to guide your role play. So looking forward to next week. And if you have any questions, please feel free to reach out. See ya.